podcast. I am Dr. Taylor, the hormone doctor and the spiritual MD. And today is one of my favorite topics. You know, some of you may not know me, but, my name is Dr. Eldred Taylor. And I've been practicing for over 30 years. And I'm an OBGYN by training, went to Emory University over 30 years ago and got taught OBGYN so that I could practice OBGYN. And so I did that for about 6 or 7 years until the turning point happened when my wife started having issues that were hormonal. She was turning 35 and periods started to get irregular. Her emotions started to get out of balance, and just things were not good at home. It was just a unsettling situation. So anyway, so I did what I was taught: birth control pills, all this stuff, and I saw it didn't work. And so I saw it 24/7. And that's the problem. A lot of times I think doctors, they see you for 10 or 15 minutes and they don't see what's really going on. And so they think everything is fine. And so I've realized that. So anyway, to make a long story short, so we tried to fix that by learning actual physiology and not what I had been told to do. And so it's really a patient came in and asked me about bioidentical hormones and progesterone. And I told her I didn't know anything about it. But I said I would research it. And that research changed my life. And so what we're going to talk about today is the research that changed my life. And it wasn't trying to get $1 million to do a new study. The research I did was understanding basic physiology. And maybe that's why I call this the ageless blueprint, because most of the answers that we're seeking have already been answered. And we keep trying to come up with a new way to answer a question that's already been answered and has been true for thousands of years. And we keep trying to change it and make something new. And what happens is we start to have these fads, and then these fads begin to deteriorate, and then we go back to that ageless blueprint. So these are lectures and things that I did 15, 20 years ago. And if you Google Dr. Taylor, and you'll see that there's some old lectures. I have one from 2010 that I did in Prince Edward Island. And all of that information is still true because it's ageless. So we're going to talk about today the 10 myths that have been around for I don't know how long that are actually harming women. Okay, and these myths have to be debunked because myths they can be beliefs, and beliefs can be stronger than facts. Okay, at one time they believed the world was flat, and it didn't. that perspective didn't change overnight. It took years. People were killed because they said the earth was round and not flat. So when there's a strong enough belief, all kinds of forces can come against you when you try and debunk a belief. And I know that because I've taken those arrows. I've gotten on stages. I've put things on ViewMedi where doctors see something and then they immediately attack me because of their beliefs and not because of facts. So we're going to talk about the facts. I'm going to debunk some myths. And I have tried to do this for 25 years. So now I'm trying to go to the public and say, here are some myths that you need to know are not true so that you can make good decisions about what to do. So anyway, let's go to the slides. All right. We're going to put those up. All right. So top 10 hormone replacement myths by yours truly, Dr. Taylor. Okay. So understanding why women stay misdiagnosed and how to fix it. Because let me tell you how I know this is true. Because at first I was just in my little office and I would see women come in and say, okay, this happened. I kept going to the doctor and they kept telling me one thing and I knew it was something else. So I'm like, okay. So then I had a patient say, you need to get on social media and see what's going on out there. So that's what I did. And so about 3 or 4 months ago, I started going on TikTok. And the questions that I hear and the stories that I hear about the women going through the conventional medical system and feeling dismissed, I'm like, wow, this is a big problem. I thought I had solved it 10 or 15 years ago when we wrote the book, Are Your Hormones Making You Sick? when I was doing, all types of speaking engagements and things like that. I was like, oh, it's all done. But 20 years later, there's a new generation of women who are going through this, and there's a new generation of doctors who are trying to deal with this. And there's a study that said only 9% of doctors know how to handle menopause and hormones. So that other 91%, that's that's who those are the people who are misdiagnosing these patients, and it's causing so much frustration. So let's go to the first myth. So why do these matter? Okay, why do these myths matter? Well, women are still being treated with outdated hormone science. Okay, now I say it's outdated, but really what it is that they're trying to create some new kind of science when the old science has already been figured out. We all know how all the hormones work. We know what it does. But what happens is we try and have these new studies to prove a point, like that estrogen is needed or testosterone is needed, and we don't go back to the original science. So blood tests are misrepresented every day. Blood tests are not how you measure hormones. I don't care who does it, that's just not the right way. Synthetic hormones are confused with bioidentical ones. When I talk about progesterone, people want to talk to me about birth control pills and Provera. That is not progesterone, and that causes confusion. Okay, testosterone is overprescribed. The thought that all these women need testosterone for energy is a myth. Cortisol is ignored, yet it controls everything. And I didn't know that either, because we wrote the book, Are Your Hormones Making You Sick? And it took me 3 years to figure out that stress was the real problem. And then we wrote a book called The Stress Connection. And now people are finally understanding that you can't say, oh, it's just stress. Stress can kill you. Stress disrupts everything. And if we don't pay attention to that, we're never going to get this hormone thing right. Women suffer because the testing method is wrong. That is the key. If we did the right test, all of these myths would be debunked, but we don't do the right test. We keep doing the same thing and we think something different is going to happen. Blood tests were never supposed to be measuring fat soluble hormones. So, anyway, and this is the biggest thing. Everybody knows estrogen. Everybody talks about estrogen. Estrogen in perimenopause, estrogen in menopause. Let me be very clear. Estrogen dominance is the overwhelming problem, not estrogen deficiency. And I can prove that if you do the right test. You can't prove it if you don't do the right test. Okay? Estrogen often rises in perimenopause. When you are perimenopausal, this is what is happening. You are beginning to transition out of your reproductive stage. When you are transitioning out of the reproductive stage, the key to reproduction, ovulation, becomes irregular. Ovulation is what produces progesterone. What happens in perimenopause, when this thing called FSH increases, FSH means follicular stimulating hormone. That means it stimulates the production of ovarian cysts, and those cysts make estrogen, and that estrogen is around to regrow the tissue so that the tissue that you shed is regrown. Now, when you have a lot of ovarian cysts, like polycystic ovary, all of those cysts are making estrogen. And ovulation is what makes progesterone. Okay. So, what is becoming irregular during this time? Not the production of estrogen. Estrogen is getting made by all of these ovarian cysts, hoping that one of them will ovulate. Now, if one ovulates, it might not make enough progesterone to balance out the estrogen. I hope you're following me here. So the last thing you need when you're perimenopausal is estrogen. Estrogen is going to make your symptoms worse. It's going to make your fibroids grow. It's going to make your endometrial lining grow. Okay, it's going to store fat. I get so many women who come in perimenopausal and they say, I can't understand why I can't lose weight like I used to. I do a saliva test. It's obvious that they're estrogen dominant. Estrogen makes you store fat. Progesterone helps you to burn fat for energy. So please, please, women, hey, look, if your doctor doesn't understand this, you need to understand it so that you don't take unopposed estrogen when you're not supposed to. Okay? I think we had a question. I didn't see it. Rebel, should I answer that question?
Beth is asking, would these apply to all women or any woman can experience these at any times?
Yeah, you can explain it because that's what PCOS is. You don't have to be in perimenopause to have these symptoms of estrogen dominant because polycystic ovary means I have a lot of cysts. Cysts make estrogen. They may not ovulate, so you will have low progesterone. Okay, let me. I've got to turn my phone off, you guys. All right. Okay. So the entire conventional menopause model is built on a false assumption, where the assumption is that all women are estrogen deficient as they get older. And that can't be further from the truth if you do the correct test. Okay. Blood tests show hormone action. This is myth number 2. Women, stop wasting your money on getting blood tests for hormones. It doesn't work. I did a residency in OBGYN. We never drew blood for hormones. We never even tested anyway for hormones. Okay. We just, this is what we did. If you were less than 45, you got birth control pills. If you're over 45, you're going to get some type of hormone replacement, I'm going to tell you. And then most of the time, when you become so frustrated, they prescribe antidepressants. And they do that so you don't feel so bad about how bad you feel. Okay, now I'm not telling you something that I've imagined. I'm telling you these are the stories that I hear on TikTok and social media. That's what these women are getting told. All right. So if you blood tests can't show you the free active hormone, it shows you what's bound. It can't show you how hormones change over the day, like cortisol. It has a rhythm. Progesterone fluctuations. Well, what you do is you pool all of the saliva. We do it through saliva. We pool it all during the day, and we come up with what the average is, estrogen or progesterone. And we can see cortisol patterns where it should be high in the morning and low at night. So hormone action is at the tissue level, is not at the blood level. So that's why this is what changed my life, is understanding how saliva can actually give me information that I can use to balance patients' hormones, and it balances their lives. I'm telling you, there's nothing more disruptive in anyone's life is unbalanced hormones. In my whole program that I'm formulating, is that the first step is get your hormones straight. The second step is now we can work on your mind, get you out of fight or flight. And then the third one is to reconnect you with your spirit, with the spirit, whatever you want to call it. It's to reconnect you with a higher power. When your life is so disruptive, you cannot look and think about the future and about deep things because you're just trying to survive. And that should not be an issue. Just talked to a lady yesterday. She's so frustrated. She's in her 40s. And I'm like, you can't live another 40 years like this. We have got to figure out how to get you back to yourself. Okay. So HRT causes breast cancer. I hear all these things. I can't take hormones because of this. I can't take hormones because of that. Yes, certain hormones you shouldn't take. Estrogen causes growth. Cancer is uncontrolled, undifferentiated growth. That means growth that doesn't have any purpose. It just is growing. And so it invades all of your normal tissue. So the last thing you would want to do is to take a hormone that can stimulate growth. Okay, so you don't want to take unopposed estrogen. I don't care if you have breast cancer or you don't. Progesterone opposes the growth aspects of estrogen. So you might want to take progesterone. And then the other thing is progesterone can get rid of a lot of the symptoms like hot flashes and all these things, because a lot of times this chemo and radiation puts these patients immediately in menopause. So immediately they start suffering menopausal symptoms. So even though their cancer may be eradicated or is in remission, they're suffering because their hormones are out of balance. And all they would need is some progesterone and to build up their adrenal gland because of the stress of the cancer treatment, and avoid the estrogen, but you can still be comfortable with the progesterone and can go to sleep and not have hot flashes and still have energy to rebuild yourself from all of the damage that the chemo and radiation has done. You know, a lot of times oncologists are very adept at killing the cancer, but have a hard time seeing the patient that's suffering, even though the cancer may be in remission. So you need to understand the different hormones and don't just put a blanket over all hormones and say you cannot take any of this. I don't care how much you're suffering. So that's what I'm saying. We have to have a deeper understanding and not just say, oh, if you have this, you do this. If you have that, you do this. No, we've got to really think and see what would be appropriate and not just put everything in one basket. This is a big one, you guys. You only need progesterone if you have a uterus. And I have been fighting this for a long time, and I still hear it. Patients tell me, this is what the doctor said. Yeah, I didn't have a uterus, so I don't need this progesterone. That is wrong. So let me tell you how that started. Okay. When we started giving estrogen to people as Premarin, start giving estrogen to people, it took a while before they did enough studies to see, hey, this is causing uterine cancer. This giving estrogen to everybody because we think they're estrogen deficient is causing uterine cancer. It's causing cancer of your womb. So what's going on here? Maybe we should stop giving people estrogen. No, 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 no. Here's a better idea. Let's get another drug that will counteract the effects of the estrogen. So then they came up with Provera. So Provera is not progesterone. They had to change it so that they could patent it. So now you're on estrogen that was causing the bleeding and stuff, but now we got the solution. We have the solution. It's Provera. So then they thought that the only reason why you need Provera is if to prevent uterine bleeding or uterine cancer. Well, that was a problem too, because then they found out in later studies, this is the Women's Health Initiative, that, hey, now this combination seems to be causing cancer. But here's the deal. It wasn't the estrogen. Now they found out that the Provera made it where it was easier for cancers to penetrate tissue, so to metastasize. So that's what happens when you don't follow physiology. You start to do all these things, and then you do one thing to fix another, and then you got another problem. So here's the deal. You don't need Provera. You don't need birth control pills. You don't need Norgestimate. You need progesterone, because progesterone receptors don't just exist in your uterus, in your womb. You have progesterone receptors in the brain that help to calm you down. It acts like GABA. So that's why when progesterone drops at perimenopause, you begin to have brain fog. You begin to get irritable because it's affecting your brain and you can't calm down. So I don't care if you have a uterus or not, you still have a brain. You still have to protect your breast from the estrogen in the environment, from the estrogen dominance that you have now that your progesterone has decreased because you're not ovulating. Your bone, estrogen helps you to not break down bone as fast, but progesterone actually builds bone. It also enhances immune function, and it is very important for the nervous system. It calms the nervous system. When women say, hey, all of a sudden I can't turn my brain off at night, it's the lack of progesterone. One of the initial things that progesterone will do in perimenopause and menopause is help women to sleep. That's usually the first symptom that goes awry. Then doctors give you sleeping pills. They give you Ambien, Lunesta. That's not the problem. You lost progesterone. You didn't lose the ability to make Lunesta. You never were able to make Lunesta. And I was going to a conference. They said, your body can make more chemicals than any pharmacy ever could make. Okay. So the things that your body can make will override any kind of drug that you can take. And if your body needs a little help, you want to give it exactly what it was making all of the time. So progesterone is required for you to sleep, for you to be calm, for mood regulation, for neuroprotection, protecting your nerves, balancing estrogen everywhere, because estrogen is affecting everything. So you have to have enough progesterone to balance that out. This myth is anatomically and physiologically false. So all you have to see, this is what I'm saying. You don't need to have a new study. When I present this information to doctors, they want to tell me about all of these new studies that prove something else or whatever they want to prove. This is how progesterone works. Okay, you can go to the anatomy lab and ask the anatomy professors, are there progesterone receptors in all of these places? And it will say, yes, of course it is. And just because we remove your uterus doesn't mean you don't need progesterone anymore. And look, I've been on both sides of the fence, and I'm just really almost embarrassed that doctors say these things. And then when I try to tell them the different, they attack me and say that I'm unscientific, that I shouldn't be on the educational platform. it's really wild how people, their beliefs will make them override basic physiology. And so that's what I'm saying. It's almost like like trying to convince people the world isn't flat. It's just, you know, uh, anyway, like I said, I've been doing this for 25 years, trying to get this message across. So now I'm on podcasts, I'm on air, anything that I can to try. And if doctors won't listen, I hope lay people will listen. And the other thing I'll tell you is that what I've learned is that it's twice as hard to unlearn as it is to learn. So it's much easier for me to teach someone who has a clean slate than someone who has been taught these myths and who have believed these myths for years and years and years, and try and get them to change. So I've just worn myself out trying to do that. So I think you with a clean slate will be able to understand this and grasp it. All right. Here's the other thing I hear all the time. Because the blood doesn't tell them anything that they can use, they say, and because when you ask to see the blood work and ask them to explain why this is the fact that you have all these symptoms and they tell you your blood tests are normal and they can't explain it, then they say, well, we don't look at blood tests. We just go by symptoms. Okay. So doctors say they go by symptoms because the blood tests do not match the symptoms. Blood tests don't reflect hormone action. Blood levels remain unchanged even after therapy. So then they give you the estrogen, progesterone, the testosterone. Then they look at your blood work and they don't see it. And they say, yeah, well, let's just go by symptoms. How do you feel? So then what happens? Let me tell you what happens. You may feel good for a week or two or a month or so. And then what happens is because they really didn't fix the problem, you tell them that you have these remaining symptoms. Then what do? They go and readjust their dose, not based on any testing. They just guess again. So then you go in 2 or 3 months, you say, well, this didn't work either. Then they change the dose again and they send you out. And you go on this never ending battle of trial and error, where if you get the right information from the beginning, you can make the right decision from the beginning. And that's what I do. When you walk into the door, if I think you have a hormone problem, the first thing we're going to test you. If I thought you had a blood pressure problem, the first thing I would do is check your blood pressure. If I thought you had a heart problem, the first thing I would do is do an EKG. But I wouldn't do an EKG on someone who I thought had a high blood pressure problem. Or I'm just saying, I don't try and take your temperature with a blood pressure cuff, and I don't try and take your blood pressure cuff with a thermometer. You use the right test for the right information you're trying to retrieve. That's all I'm trying to get across. All doctors know that blood work doesn't tell them anything. The GYN endocrinology book tells them that the blood work doesn't tell them anything. But they keep doing the same wrong tests, thinking something different is going to happen. Then I talk to doctors and they say, oh, no, I take the sex hormone binding globulin, and then I take the LH and FSH, and then all of this complicated manipulation that still doesn't tell them anything. And then they just keep guessing. So, all right, you see that you see that I'm frustrated because I can't believe that instead of saying, oh, this blood test isn't telling me anything, the other thing would be, is there another test that might work better? And then when I try to present another test that might work better, a lot of doctors try and tell me that test is no good. And they already know that the blood test isn't any good. So anyway, here we go. This is the other thing I hear is that, oh, I can't take progesterone because I had a blood clot. I can't take progesterone because of this or that, because it made me depressed. It made me this. That is because you probably did not really take progesterone. You took something called a progestin. What a progestin is several things. It's what's usually in birth control pills and in other progesterone-like drugs. So you take progesterone, and then you have to change it or alter it just a little bit so that it's not a natural compound. Then you can register it as a drug. Then you can patent it, and then you can set your own price for 7 years. So they don't want to use progesterone. They want to use these derivatives. But if you know anything about chemistry, if you change one molecule in a substance, it's a totally different substance. In the periodic table, that chemistry thing that you remember from high school, the difference between all of those elements is one electron, and one electron can change a whole element. So just think, if you change something in progesterone, you got a whole different you have a whole different hormone, and it does a whole different set of things. And a lot of it is opposite of what progesterone is, because it's actually blocking the progesterone receptor. So your cells have this receptor looking for progesterone, but if it has a progestin in it, now you're actually more progesterone deficient. That's why when I talk to you about all of the things progesterone does, you talk about your experience with birth control pills and synthetic progestins, and you say, well, that can't be true. No, it is true. You just didn't really get progesterone. And the problem is doctors and even some pharmacists don't know the difference between progesterone and progestins. So that's where the confusion lies. And again, I hope you guys are seeing how harmful this is, the misinformation that you're getting and how it is affecting your decision making. And I hear women all the time say, I knew I shouldn't have had that hysterectomy. I knew I shouldn't have done this. It did. Please respect your women's intuition. Please do that. When you don't feel right about something, investigate it. Start asking questions. Don't do something that you don't feel right about. I very much respect a women's intuition because I've been married for 40 years. I've been an OBGYN for a long time, and I know women and they know their bodies. That's why I went into OBGYN, because women care about their health. Men don't go to the doctor. The men that come to my practice, usually it's because their wife made them. So anyway, please, I want you so badly to get this information, because I see how misinformed you are and how doctors aren't helping to inform you properly. All right. So anyway, let me get off my high horse. This is another one. Women should stop hormones after age 60. This is something that the FDA came up with, and I've been hearing this on TikTok too. What do I do? I'm 60. What do I do? Let's answer that when we come back from the break. Okay. All right. Let's go to a break.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
You know, I was just listening to the intro or whatever, and it's talking about ancient secrets. You know, again, women's hormones have been doing this since the beginning of human life on Earth. So this is really not a secret. I don't know when all of this was really, determined scientifically, but I think women, men, we inherently, women's intuition knew these things. And we're trying to create something new that has been around for ages. And so if we really understand these ageless blueprints, which human physiology is really ageless, okay? If we really understand that, it would answer a lot of our questions that we have. So let's talk about this. Women should stop hormones after age 60. Now, this is what the FDA just came out that they thought hormone replacement was safe up until, this was they said. They said you should start it within 10 years of menopause. And then they say, but you should stop it after age 60. Well, some women don't go into menopause until they're 50. Or let's say 55 or whatever. So, trying to do it within that 10-year period is hard to do. And then what is magic about age 60? Why isn't it 61? Why isn't it 59 years and 27 days? It's based on just some arbitrary number. There's there's nothing magical about age 60 when it comes to hormone replacement. What matters is, I don't care if you're 30, 40, 50, 60, 70. The key is, are the hormones balanced? I don't care what age you are. If you are 22 with polycystic ovary, you need to understand that your problem is estrogen dominance. It's not that you need more birth control pills or a different birth control pill. Okay, so after 60, are the hormones in balance? And you don't know that unless you look where the hormones are, which is in the tissue, and that's why you do saliva testing. So I'm telling you is that I don't care what age you are, if you have unbalanced hormones, it's a problem. And I don't care what age you are, if you have balanced hormones, it usually is not a problem. All right, now I'm not telling you, I have to be careful what I say. I'm not trying to tell you how to cure or diagnose. I'm trying to tell you how to get your hormones back in balance. And the key is knowing the right test to see what's out of balance. And so if you're 60, 65, that's crazy. I'm over 65. I won't tell you how old my wife is, but that's not a time to stop. Okay, that is a time to continue making sure your hormones are balanced. And you do that by monitoring your hormones with saliva, not with blood. Because they don't have good information, they have to do these arbitrary things, like say there's a cutoff at age 60. There's nothing magical about that, because women of all ages still want their brain to work. Why would you stop these hormones so you can get your foggy thinking back? Bone density, this is the key after 60. Sleep quality, you're telling me you want to stop sleeping after 60? Your metabolism, you want to stop burning fat? Do you want your immune system to shut down? Do you want your emotional stability to go back and be haywire again? Aging without hormones is optional. It's not necessary. That is the key, is that you don't have to stop at 60. If you have balance, I don't care if you're 80 and your hormones are in balance. And here's the key. Most of the time, you don't need extra estrogen. I'm just usually prescribing progesterone to balance out the estrogen that your fat tissue is making. I don't know if I made this clear. Your fat tissue makes estrogen, and estrogen makes more fat tissue. All right. So if you are more than 10% over your ideal body weight, you have enough fat to manufacture estrogen. So most women, when they're postmenopausal or perimenopausal, or even with polycystic ovary, the answer is to match their progesterone with the amount of estrogen that they are making. They usually do not need extra estrogen unless they don't have a lot of fat tissue. So that is probably one of the most important. And here's the problem why doctors don't pick it up. Because the estrogen is made in the fat tissue, because it doesn't come from the ovary, you cannot see it in the blood, but you can see it in the saliva. So that is a big confusing point to both doctors and patients. So yes, you can take hormones even if you're over 60. And this is last but not least. Okay, I think this is the last one, and then we'll talk just how to wrap this up. Women need testosterone for energy and menopause. And again, I told you I did a residency in OBGYN, and we never even considered giving testosterone to women. I mean, it wasn't even a consideration because one, the blood test always showed that testosterone was low in women, even if they were hirsute, if they were having hair and all this stuff on their face, still the testosterone would be low. Okay, so now, so they can market hormone replacement, they take that normally low testosterone and say you need more. But testosterone was never meant to be a woman's hormone. But good marketing and media have convinced women that testosterone is what they need. But the problem is not testosterone. It's usually a cortisol issue. So women do not need testosterone for energy. Energy comes from cortisol, not testosterone. Cortisol mobilizes glucose in a pattern during the day where it should be high in the morning and low at night. That's why you get a good night's sleep. You wake up, you get a flow of cortisol or glucose that slowly dissipates over the course of the day. And then at night you go to sleep and you rejuvenate yourself and you do it all over again. That is the pattern that gets disrupted when women are fatigued and they can't stay asleep at night. It's a cortisol disruption pattern. It's not a testosterone disruption pattern. So here's what happens. Now, initially, most of the women will get a boost. Okay, They'll get a boost. Oh, I feel good, because testosterone is a more active hormone. It's a man's hormone. So men, they like to be active and compete and have war and kill each other and all this stuff. All right. So that's what testosterone does. And so it'll give you that initial boost. But as you stay on it, it will begin to accumulate because it's a fat soluble hormone. It doesn't stay in the blood. It likes to stay in the tissue. And then eventually you're going to get hair loss. You're going to get acne. You're going to irritability. I see it all the time. Women say, oh, yeah, this testosterone makes me feel great, but my hair is falling out and all of a sudden I'm breaking out. So the tissue level builds up over time. So what feels good initially eventually is going to cause a problem because it's not the real problem. All right. The real fix is you restore cortisol rhythm, and that restores your true energy. No side effects and no virilization. Virilization means having manly characteristics. You cannot use blood tests to justify testosterone in women. Blood testosterone is always low because it's supposed to be low. So, they take this as normal and say, oh, wow, you need testosterone. Here's your problem. That is not the case. Rebel, let me just ask you, I know you're not feeling good, but am I making sense?
I believe you are. It's the point that it's very confusing because here you are, a lot of women, not you, but a lot of
Mhm.
women are confused because of all of the lack of better word crap that they have been told throughout their lives. So,
No.
and
Yeah.
we thought, oh, well, doctors know more than us. I have to stress this, ladies and gentlemen, you know your body more than any doctor ever will because you've had it as long as you are old.
Yes.
Learn to listen to yourself and
Yeah.
question doctors. They're not all know-alls, end-alls, and
Yeah.
they can be wrong.
I couldn't have said it better myself. See, this is coming from a woman. She knows the frustration that I have to see on TikTok or what I see in my office or what I used to see in my wife. So this is something I always say, this is something you should have learned in 8th grade health class. You should have learned how hormones work, how your period works, how reproduction works, how menopause works. You should have been told this is how your life cycle is going to be. And it is. It's going to be governed by puberty, your reproductive stage, perimenopause, and menopause. You're going to be in one of those stages all of your life. So you need to understand what's going on in all of those stages and how can I better adjust what I'm doing to keep all of those stages as smooth as possible. And when those stages are in balance, life can be great. When they're out of balance, your whole life is governed. So you start from puberty, then you get endometriosis. Then as you get older, you have fibroids. And then after that, you start irregular bleeding. And then you get the hot flashes. All of that is due to imbalances in those areas of your life. If you can balance it, and how do you balance something? You measure it in all of those stages of life. If we measure your hormones through saliva, we can balance you through that whole life. How do I know that? Because that's what's been happening in my house for 40 years. I've been married for 40 years. So let me see, how old is my daughter? She's 29. That's when we really started getting this revelation. So all of these stages in my wife's life and in my patients' lives that I've been doing this for 25 years, we can balance you through all of those stages of your life if we test you appropriately. Just like I could balance your blood pressure through all those stages of life if I test your blood pressure. All right. So let me see, we got 10 minutes. So cortisol doesn't affect sex hormones. So I started talking about cortisol. I did a video that said cortisol affects ovulation and estrogen production, which is pure hard science. And on this medical platform, they told me, why do they allow people like me on their platform for education when I'm only talking about physiology? So anyway, cortisol is the master switch. And that's what we found out when we wrote the book, The Stress Connection. After we wrote the book, Are Your Hormones Making You Sick? We found out that stress is the real switch that turns things on and off. So high cortisol disrupts ovulation. High or low cortisol disrupts ovulation. It disrupts progesterone production because when your body thinks you're in fight or flight, the last thing they want you to do is to have sex. So it lowers your libido, and to have a baby. So it cuts off ovulation. So now your progesterone production is down. Your thyroid production goes down because cortisol affects your thyroid and insulin and sleep and mood and inflammation. You cannot fix estrogen or progesterone without fixing cortisol if it's out of balance. And we learned that the hard way. Took us 3 years to learn it, but we learned it and then we wrote a book about it. That book is 20 years old. And doctors still don't understand cortisol the way they should. And if you look this up or chat GPT it, saliva testing is the gold standard for cortisol because it can show you a pattern over the course of the day. I don't know why they don't realize that it's the gold standard for all fat soluble hormones. It's just because the belief that the world is flat. And it just takes so much to get rid of such an ingrained belief when you're trying to tell them that the world is round. Okay. It's not estrogen, it's all these other things. The world is not flat and only based on low estrogen. It's all of these things. It's balance, not imbalance. All right, so let's move on. One test and one appointment can fix hormones. So, patients go in, they have a problem. Here's your birth control pill. See ya. No, it takes more than that. You got to listen to the patient. You got to figure out what tests they need. What stress caused this? How can I help educate this patient so they feel better? They know that I understand what is going on with them and I can give them a good explanation. So that is 50% of my job, to get you to understand that this is not some random, unexplainable issue that you're going through. It's simply an imbalance issue. So hormone balance requires pattern recognition, retesting, lifestyle and stress connection, nervous system regulation. I talk a lot about meditation now. Cortisol control, education, time. Hormone clarity is a process, not a prescription. And that's why we created the Ageless Blueprint. I have a hormone clarity. I'm trying to recruit hormone clarity coaches. Women need clarity. That's what Rebel was talking about. There's just so much confusion. We've got to bring clarity into hormone replacement. Again, they started hormone replacement back in the 1960s when I was born. Okay. So this is relatively a new concept. And so what you have to understand about this new concept, a lot of false beliefs were initiated because we were just uninformed. And so the thought about estrogen deficiency and all of that stuff, that was ingrained early on, and those beliefs have not been overcome yet. And so that's why we need a deeper meaning. We need to go back and relook at these original assumptions that the world is flat, that all women need estrogen. Okay. Those are those kind of beliefs that take time to debunk. I didn't know it was going to take 60 years to do it, and it's still not debunked, but I'm giving it a heck of a try right now to see if I can make a dent in this the world is flat philosophy. Okay. All right. So why these myths exist is outdated menopause model, reliance on blood tests, lack of bioidentical hormone training, confusion between synthetics and natural hormones, pharmaceutical influence, overuse of testosterone pellets, no understanding of cortisol's roles. You are correcting, it's me. You are correcting decades of misunderstanding, because I need people like Rebel and other people to go out and tell other women, hey, don't believe these myths. This is what really is affecting you and affecting your health and your emotions and your family and your community. It's all can be traced back to these transitional changes that cause imbalances. All right, so here's the Taylor method. And I'm trying to teach people this hormone clarity method, that you look at balance and not just levels of hormones. You don't want the level of testosterone that you had when you were 25. You look at saliva. You look at patterns. You don't panic about what to tell patients and tell them, I just go by symptoms. You got overdiagnosed. You got them. They really don't have a disease, so there's nothing to diagnose. You have to just rebalance them and teach what you learn. So as patients learn this, I need them to teach somebody else, because these concepts are not very difficult. All right. So if you want true hormone clarity, please join my Ageless Blueprint School. You'll see all of this as scrolling. There's all kinds of information on there. A lot of it is free. Even if you don't pay the $10 a month, a lot of information is free. I have a mini hormone clarity course. It's absolutely free. I want you guys to not be confused and have the information you need to make the right decision. So please look at all my links. subscribe to my YouTube channel. I got over 300 videos on that YouTube channel. I need you guys to look at it. I have on all kinds of subjects. Follow me on my Substack, all of my links. Please follow me. There's all kinds of information there. So, hey, Rebel, I saw there was another question popped up. I just couldn't see it in time.
We have a few.
Okay,
Okay,
great.
let's try to get through this because we have 4 minutes.
Yeah, okay.
Carrie wants to know, can you have PCOS after your period has stopped?
No, well, you don't have PCOS. You just have an estrogen dominance problem. It could be due to too many cysts that you don't even see or they don't even see on the ultrasound. What you're really describing is estrogen dominance. If you say you have PCOS, that's just the label that doctors put on there. It just means you have a lot of cysts, but it's not telling you what's wrong. The cysts are making estrogen and you don't have enough progesterone to balance it out. So you can measure your induced saliva, we match it with progesterone, and your PCOS symptoms will subside. All right, let's go to the next one. You have another question?
Yes, we do. Jesse,
Okay. Mm-hmm.
can our bodies get rid of the excess medication given? And if not, how does the body react to the excess? That's
Well,
that came in when people are getting hormone replacements or whatever. So if you're getting this, what happens?
well, so your body has to detoxify this stuff, and that is your liver. So you can take things like milk thistle. Just fasting gives your body time to detoxify itself. So people go on intermittent fasting. They may go on a 1-day fast. All of that helps your body to detoxify itself. If it's really bad, we use IV glutathione, which is the master detoxifier. We use that in our office when patients have had chemotherapy or something, and 2 or 3 days later, they're trying to get rid of the after effects. So IV glutathione is the real way to do it. And yeah, it's all about helping your body detoxify itself. All right, next question. We got 2 more minutes.
Kyle wants to know, why do doctors do blood tests if they know they don't work?
That's the only thing they know to do. And the patients come in demanding something. Hey, I got all these symptoms. And the only thing they know to do is a blood test. But they know the blood test is not going to tell the main thing, but they have to do something to satisfy the patient. So you got to understand, doctors are in business too. And you have to try and do what the patient wants. And so then the other thing is to prove that, hey, it's nothing in your blood work. So here's the birth control pill. And I had a lady yesterday who said the doctor told me the only thing I could do was take birth control pills and an antidepressant. And I'd say, hey, you're on the antidepressant so you don't feel so bad about how bad you feel, because she still feels bad. All right, next question. We got 1 more minute.
All right, we have 2 more questions. This one,
Okay.
Jen wants to know, what causes male pattern baldness in women?
Too much testosterone, just like it causes male pattern baldness in me. Yeah, and you can have too much testosterone without taking testosterone, and that's just the issue. So, but if you do it in the saliva, you can see it, and then there's ways to do it. Sometimes testosterone comes when you don't have enough progesterone, so then testosterone comes in, and that's why you lose your hair. So it's really still a progesterone deficiency that's causing the testosterone to increase. So we got a few seconds. Give me the last question real quick.
Sorry, the last question is, Danny wants to know, how many times do you need to do the saliva test, and how often does saliva change?
It doesn't change often. I've been using it for 25 years, and it's the key to my practice. So what we do is we do an initial test, we correct the imbalance, and then we recheck it in 3 months. If that's okay and everything's good and she's fine, then we do the test twice a year. Or if your symptoms change, we'll see, because sometimes if you lose weight, gain weight, if you had a lot of stress in your life, then it will cause your symptoms to come back, because remember I told you cortisol just like screws up everything. So sometimes if a patient had a sudden death in their family, if they had a sudden job loss or some financial crisis, all their symptoms will come back because stress screwed up everything. All right. So I know we got to go. Hey, watch me, follow me. Just do whatever you can to spread this message, you guys. And I'll see you next week.
Thanks for joining Dr. Taylor today. If you missed any part of this show, Just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.